Knock, knock. Hand hygiene. Hello, Mr. Rogers. My name is Juan. I am your nurse for today, and we need to conduct a physical assessment. Now, this requires for me to touch you. Are you okay with this? Patient agrees to be touched. Can you please state your name and date of birth? Checking the wristband. Okay, very good. Now, first thing I want to do is we do the Snell test. Have the patient stand up, be 20 feet away from the Snell chart. Patient displayed a 20 over 20 for 20 for 20 for the vision without glasses. And now, Mr. Rogers, I'm going to ask you a couple questions. Do you know where you're currently at the moment? Okay. Do you know what day it is? Do you know who the president is? Very good. Do you know why you are here? Okay. Do you know, or how is your mood today? How is your mood? Okay. And do you have any pain? No pain. Very good. Okay. Are you allergic to any medication? Nope. Allergic to no medication. Are you allergic to anything in the environment? No. Okay. No allergic to nothing in the environment. Very good. At this point, I will take the vital signs for my patient. The vital signs was 98.8 for Fahrenheit for temperature. Patient had a pulse of 78 per minute. Respiration rate was 19 per minute, and the blood pressure was 125 over 80. Now, to continue with the questions, Mr. Rogers, we're going to talk about your stool. How often do you think you go? About 1 or 2 times a day? Okay. And how do you think the consistency and the color is? Okay. And when's the last time you had a bowel movement? Okay. Now let's talk about your urine. How often do you think you go? Okay. When was the last time you went? Okay. And do you have any burning or pain sensation as you're urinating? No. Very good. And what type of color is it? Okay. And is there any odor or any foul smelling senses as you're urinating? No. Okay. Are you currently in any pain? No pain. Very good. Now we're going to have some cranial nerve tests we're going to conduct with the patient. So, first thing I'll ask the patient to do, if you can smile for me. Stick out your tongue, left and right. Very good. At this point, I will have my patient, if you can close your eyes and cover one nostril. I have something here for you to smell. Please tell me what it is. Very good. Now, please close your eyes again and close the other nostril. Thank you. Very good. At this point, I'll have my patient stand up and have him walk 5 feet, steady gait. And I have my patient walk back, feet, heel to toe. All right. As I have my patient standing up, I'm going to have his hands close to his body, stand up straight and close your eyes for the Romberg test. And I will have my hands front and back for the patient for safety, and he displayed no swaying. At this point, I will ask my patient to bring your knees up. Very good. Knees up. Okay. I'll have my patient sit back down, turn their head around, and I'll do the whisper test. So I will tell my patient, I will whisper something to them, and they'll cover their one ear and close their eyes. Just repeat what I say. Very good. Now cover your ear and close your eyes and repeat what I said. Very good. Okay, so now I will conduct the physical assessment, starting with the top. So, hand hygiene. I will inspect the ears first. So, to check the ears, the ear canal is pink, no drainage, no swelling. Check the next ear, also pink canal, no drainage and no swelling. Next, I will check my patient's pupils for the constriction, just for a couple seconds in each eye, Mr. Rogers. Pupil constriction, and then consensual constriction. Very good. Next eye. Very good. Very good. Now I will have my patient open their mouth to inspect the mouth. Very good. Oral mucosa is pink, teeth are white, and the tonsil grade is 1. Very good. You can close your mouth, Mr. Rogers. Now, if you could just do me a favor, and with your eyes, not with your head, just with your eyes, can you follow my pen, please? Cranial 6th grade field. Cranial gauge of. Very good. So now you can also follow my pen. All right, very good. And at this point, I would ask my patient to have 45-degree angle to check for the GVD. No sign of JVD. And no sign of JVD. Okay, very good. Next, I will be checking your shoulders. So if you just shrug up for me. Very good. I will also check for skin trigger. Very good. Now I'll also be checking your lymph nodes. And this way I'll be doing circular motion. Very good. Next, I'll be checking my patient's range of motion. So can you just please stick out your hands out like this? Touch your elbows. Very good. Next, have your hands on your side and 180-degree angle up and down. Thank you very much. Next, I'll be inspecting my patient's arms. Okay, very good. Do you have any pain or any tenderness? Nope. Patient's skin is warm. Checking for edema. Very good. I'm gonna have my patient, if you can please squeeze my hands. Very good. Capillary refill for each hand. Under 3 seconds. Under 3 seconds. Very good. Let's see. I checked the skin. There's no bruising, no scarring, no issues at all. Very good. Okay. Now, at this point, I am going to check my patient's reflexes. I would make sure alcohol swab this. Make sure this is nice and clean. Now I'll be checking the bicep reflex for my patient. Now my patient had a forearm flexion. Check the next one. Forearm flexion. I'll be checking the triceps now for my Mr. Rogers. We had a forearm extension. And another forearm extension for the, okay, very well. Now we're going to also be doing the knees for Mr. Rogers. Now Mr. Rogers, have you had any surgeries? None, very good. Now we switch this over to this side. Right, lower leg extension. Lower leg extension. Very good, Mr. Rogers. So next I'll be checking your carotid artery. So I'm going to hear it. Now at this point I'm going to change this to the bell. And I'm going to place it between the sternocleidomastoid mastoid muscle and the trachea. Now Mr. Rogers, please hold your breath for me. Very good. You can breathe and hold your breath for me one more time. Very good. Now at this point I'm also going to palpate the carotid artery. Very good. Very good. There was also no bruising when I inspected the patient's carotid artery when I heard it. Now we'll be listening to your heart sounds. Now I'll turn this over to the diaphragm. So we're going to listen to the aortic, which is the secondary intercostal on the right sternum. S2 is louder. Secondary intercostal on the left side, left sternum. This is the pulmonic. S2 sounds are louder. Underneath it we have the Eric's point, and this is third intercostal, left sternum. S1 is equal to S2. Beneath it, we have the tricuspid. We have the fourth intercostal, left sternum. S1 is louder. And then finally underneath we have the mitral valve, the fifth intercostal, mid clavicle line, and this is S1 louder. Very good. And at this point, Mr. Rogers, I'm also going to be listening to your lung sounds, okay? And at this point, when I stick my stethoscope, when you feel it, just take a deep breath for me, okay? Thank you very much. Very good. Next, I'll be checking the right lobe. So Mr. Rogers can lift the right arm up for me. Thank you very much. Between the fourth and sixth intercostal space and the mid-axillary line. Very good. Now with this, I'm going to ask my patient if he could turn around, and I'll be checking the respiratory sounds in the back as well. Thank you, Mr. Rogers. And the same thing applies. As soon as you feel my stethoscope touch you, please take a deep breath for me. Very good. Now inspecting the patient's back as well. He has some scarring in the back, but other than that, there's no lesions. There's also no type of bruising. Okay, and the patient's skin is a little tan, dark brown. Now, Mr. Rogers, I'm also going to do some expansion, some respiratory expansion. So if you can just take a deep breath for me. Very good. Now, I forgot to do this, Mr. Rogers. I apologize, but I just have to hear your heart, your beat for 60 seconds. The mitral valve. So I listened for 60 seconds, and the patient had a 78 pulse rate. Thank you, Mr. Rogers. So next we'll be checking the abdominal area. This right lower quadrant, right upper, left upper, and left lower. So Mr. Rogers, I'm just going to be listening. Very good. Patient had about 16 to 20 gargles. Next, I'm listening for any brewing for the patient. Switch over to Bell. Very good. Patient displayed no signs of brewing. Okay, Mr. Rogers. Next, I'm going to percuss. So I'm just going to do some light tapping, okay? Okay, and next I'm going to palpate. So if you feel any tenderness or any pain, just let me know, okay? Okay, very good. Next, we're going to be going to the lower extremities. Okay, Mr. Rogers. So I'm going to see if you have any tenderness or pain, just let me know. Skin is warm. Checking for edema. No edema is present. Okay, Mr. Rogers, if you could please put your knees up for me. Very good. Very good. I'm going to check the capillary refill. Under 3 seconds. In under 3 seconds. Alright, next I'll be checking the popliteal pulse. Very good. And now I'll be checking the dorus patellis pulse. Very good. Next, Mr. Rogers, can you please shake your ankles for me? Very good. And very good. Now, we're going to have the patient, if you can just please push against my... Okay, very good. And then can you also pull against? Very good. Thank you, Mr. Rogers. I'll have you sit back up and lower you all the way down to the bed. And with that, the physical assessment is over. Thank you very much.